Good evening, everyone. We'll start the class. People can keep joining. I hope everyone is able to see the slide. So, today we are going to discuss the questions for week 4. I hope everyone has attended last 3 weeks assignment discussions. So, in this class, we discuss the previous year questions for that particular week. So, today we are going to discuss the previous year assignment questions for week 4. Okay, so and yes, rule number 1 of class, do not unmute your audio or video. Okay, because many people are there, we do not want any chaos, so please keep yourselves mute for audio as well as video throughout the class. Whatever conversation you want to have with me, please write it down in the chat box. Okay, so, and the second thing, for someone whoever is new to the class, that I will be showing you the question. You will be given around 5 minutes time for each question. You have to think whichever option is correct according to you. Please write it down in the chat box. Okay, I will be seeing all your answers, and at last we will see what is your score out of. Today we have 25 questions, so out of 25 how many correct answers and wrong answers you have given. You keep noting down how many correct answers and wrong answers you are giving, and at last please let me know your score. Okay, I hope everyone is clear with the rules. Okay, so we'll start with the first question of today. Dash helps in carrying oxygen to the entire body: iron, vitamin B12, protein, magnesium. Start answering. Continuously I'm telling you all in the previous week also I have told, and I'm telling you now as well, that please try to join by 7:10. Okay, because admitting in between the class is little bit disturbing for me as well. Because if possible, please join by 7:10 to 7:15, or else I have to keep going back and forth to keep admitting you people. Okay, so please be on time so that you do not miss out on any question, as well as you are able to actively participate in this interactive session. Okay, and whoever has any queries, please write it down in the chat box. If you raise your hand, I won't be able to understand. If you have any doubts, please write down in the chat box. Okay. I want answers from each of you, so please try to answer. Okay, participate actively in the class. Okay, let's see what is the correct answer to first question. It is A. Iron. Iron helps in carrying oxygen to the entire body. So here you can see how the mechanism works. Okay, so where oxygen binds to the hemoglobin, the red pigment present in our body, and then the hemoglobin in the blood carries the oxygen from the lungs to the rest of the tissues. So in hemoglobin, iron ions are there. Due to, so that is what helps in carrying the oxygen from the lungs to the rest of the tissues, and then oxygen is released from the cells. Okay, I hope this is clear. We'll move on to the next question. A nurse explains the benefits of delayed cord clamping to a pregnant lady. What do you think could be the benefits? It helps to improve vitamin A store. It helps to improve vitamin D store. It helps to improve calcium store. It helps to improve iron storage in the liver by allowing blood flow between placenta and baby. Start answering. Please keep yourself mute throughout the class. Okay, let's see what is the answer to the second question. It is D. It helps to improve iron storage in the liver by allowing blood flow between the placenta and the baby. So, if what so delayed cord clamping means you cut the umbilical cord little bit delayed, and there are benefits for this, right? So delayed cord clamping is a birth practice where the umbilical cord is not clamped or cut until after pulsations have ceased. So if you cut the cord little bit delayed, it can prevent complications with placental delivery and postpartum hemorrhage as well. Okay, so what is the optimal time to wait? It is around 2 to 3 minutes. And the benefits, if we count, it gives increased iron levels, it uh, facilitates placental transfusion, and also it gives higher birth weight. Right, babies receive around 25 to 40% more blood volume from their mothers if you wait for 2 to 3 minutes more before cutting the cord. Right, so there are a lot of benefits. Moving on to the next third question. What three key nutrients are required for the early development of the baby's brain and spine? Folate, B12 choline, folate, B6 potassium, calcium, folate, B12, iron, calcium, B6. Okay, let's see what is the answer to this question. It is A. Folate, B12, choline. So the three key nutrients required for early development of the baby's brain and spine are folate, B12, and choline. Here you can see the key. Also, there are other key nutrients which are listed along with these three. You can check them out later. Okay. Moving on to the next, dash fruits as they have the maximum amount of vitamin C, raw or ripe. Start answering. Please everyone try to join on time by 7:15 maximum. Okay, it's very disturbing to keep admitting people throughout the class. Okay, this was a very easy question. Let's see what is the answer. It is A. Raw fruits have maximum amount of vitamin C compared to ripe fruits. Okay, here you can see a list of the vitamin C rich foods which you can check out later. Moving on to the next, which of the following increases the risk of childhood obesity? High weight gain in underweight mothers, high weight gain in mothers who are not underweight, low weight gain in mothers, no weight gain in mothers. Start answering. We'll go a little bit faster as many people have some other work to do. Okay, so please start giving answers quickly. Okay, let's see what is the answer. It is B. High weight gain in mothers who are not underweight. So, the which of the following increase the child risk of childhood obesity increases if the mothers are having high weight gain who are not underweight. Okay, moving on to the next. Folate is essential for DNA synthesis and hair growth, muscle growth, fetal cell development, bone development. Start answering. Sixth question. Okay, let's see what is the correct answer to this question. It is C. Fetal cell development. Folate is essential for DNA synthesis and fetal cell development. Okay, moving on to the next. First essential nutrition action done for a newborn is delayed cord clamping, breastfeeding, breast crawl, keeping the baby with the mother. Whoever are joining late, please catch up and start answering the question from wherever you are seeing. Okay. Okay, let's see what is the correct answer to this question. It is A. Delayed cord clamping. We already discussed about this, so that is the first essential nutrition action you can do for a newborn baby. Okay, moving on to the next. Ideally, a baby's diet must include all dash food groups 6, 5, 8, 10. Start answering. Okay, let's see what is the correct answer to this question. It is C, 8. A baby's diet ideally should have all 8 food groups. Okay, here are the food groups given. You can check them out later. Moving on to the next. What should a just delivered mother do to pass on injection infection fighting elements, good fat and nutrients to a newborn baby? Give formula milk, breastfeed the first milk that is colostrum, give honey in formula milk, give honey in animal milk. Okay, here's a very obvious answer which you all should know by this time, I think. Okay, so give answers correctly. Keep noting down how many correct answers and how many wrong answers you all are giving. Okay, okay. Let's see what is the correct answer. It is B. Breastfeed the first milk that is colostrum. Already we know that after delivering, the first thing that the newborn baby should get is colostrum. Okay, so what is colostrum? We have already discussed. I will discuss once more. Colostrum is a milk like fluid formed by all the mammals before they get into their lactation period during pregnancy or while breastfeeding. And what are the benefits? Boosts immunity, prevents allergies and infections, reduces inflammation, reduces the risk of cancer, strengthens the gut, and enhances metabolism as well. Okay, moving on to the next. An expecting mother wants to reduce the chance of neural tube defects in her baby. Which nutrients should she take? Folate, vitamin A, vitamin C, and iron. Start answering. Okay, let's see what is the correct answer. It is A, folate. So if the mother wants to reduce the chance of neural tube defects in her baby, she should take folate rich diet. Okay, moving on. So here you can see how the folate mechanism works to prevent neural tube defects. Okay, moving on to the next question. Deficiency of which nutrient during the first 1000 days leads to impaired learning, impaired social emotional behavior, and higher levels of anxiety and depression later in life? Calcium, iron, vitamin B1, magnesium. Start answering. 11th question. If your screen is not visible, please exit from the class and join again. I think other people are able to see the screen, so it is not a problem from my side. Whoever is raising their hands, please write down your query in the chat box. Do not unmute yourself. I hope you all are submitting your current assignments on time. Okay? Because that carries marks. Please do not delay those things. Okay, let's see what is the correct answer. I hope everyone is done, right? Okay, I got a thumbs up. So the correct answer is B, iron. So iron deficiency can lead to impaired learning, impaired social emotional behavior, higher levels of anxiety and depression later in life, right? Here you can see how this works out, at which stage, at which trimester, which nutrients are needed. I have given a chart here. Okay, you can check this chart at later uh, when you see go through the session again. Okay, moving on to the next. Daily recommended intake of vitamin C for lactating mothers is 90 mg, 120 mg. Start answering. Okay, I hope everyone is done. It can be both MCQs as well as subjective. Okay, the correct answer is 120 mg. So the daily recommended intake of vitamin C for lactating mothers is 120 mg. Okay, here it is given in detail. You can read this. For infants aged 6 months or less, it is 40 mg daily. Okay, after you have given birth. For when you are in the lactation period, it is 120 mg. Moving on to the next. If a woman smokes during pregnancy, how does it affect the baby? Does not affect the baby, causes low birth weight or premature delivery, causes high birth weight, reduces the risk of obesity in babies later in life. Okay. First, yes, it is. That's what I told. The first essential nutrition action for newborn babies delete cord clamping. That's what we discussed, right? That was the correct answer. So for this question, the correct answer is causes low birth weight or premature delivery. So if the mother is smoking when she is pregnant, it can lead to low birth weight or premature delivery of the baby, which is not good at all, and hence the pregnant mothers are suggested to avoid smoking during that time. Okay. Here you can see there are still more other side effects for smoking, like low birth weight, premature birth, stillbirth, respiratory complications, congenital heart defects, CNS defects, fetal death, and infant death as well. Okay, moving on to the next, calcium deficiency in pregnant women causes high blood pressure, heart diseases, diabetes, asthma. Start answering. Okay, let's see what is the correct answer. It is A, high blood pressure. Calcium deficiency in pregnant women causes high blood pressure. Here you can see what are the other symptoms for calcium deficiency, like brittle, weak bones, osteoporosis, bone fractures, weakness and fatigue, problems with proper blood clotting, delays in children's growth and development, heart problems involving blood pressure and heart rhythms. Okay. Next, 15th question. Vitamin C acts as free radical or antioxidant. Start answering. Please keep yourself mute. Okay, let's see what is the correct answer. This was a pretty easy question. It is B, antioxidant. Vitamin C acts as an antioxidant for our body, which helps protect your cells against the effects of free radicals. It is not a free radical, but it protects us from the effect of free radicals. So, what are free radicals? The molecules produced when your body breaks down food or is exposed to tobacco, smoke, radiation from the sun, X-rays, or other sources. So these free radicals are harmful for our body as they can lead to heart disease, cancer, and other diseases. Okay, moving on to the next. First 1000 days is the time span for from conception to the baby's second birthday. True, false. Okay, let's see what is the correct answer. It is true. So for the first 1000 days is the time span from the time the birth is concepted to the baby's second birthday. Okay, moving to the next. Pregnant women can pass black stools after consuming dash tablets, calcium, vitamin, iron, folic acid, omega 3 supplements. Okay, let's see what is the correct answer. It is C, iron folic acid. So, if the pregnant woman is consuming these tablets, it can lead to black stools, but it is totally fine. There is no need to worry about it at all. Here you can see the what the stool color indicates. Okay, if it is green, it is generally due to green dye or green vegetables or antibiotics, or it can be also bacterial infection. Brown is the normal poop color. Yellow is for excess fat or nutritional deficiency or small intestine infection. Bright red is for red foods or drinks, or it can be also hemorrhoids or bleeding. Lower bleeding in the lower digestive tract. Black or dark brown is for if you're taking iron supplements, like it was given in the question. It can also be bleeding in the upper digestive tract. White, clay, or light colored is for if you're taking antidiarrheal medications or if there is lack of bile juice or if bile duct is blocked. And finally, reddish is for red foods or drinks. Bright red was the same as well. It can also be bleeding in the lower gut or rectum. Okay. Next question. It is said that malaria is a risk factor for iron deficiency. Why? Because mosquitoes suck a lot of blood. White blood cells are destroyed in malaria. Red blood cells are destroyed in malaria. There is blood loss due to mosquito bite. Okay, let's see what is the correct answer. It is C. So, what happens if you're having malaria? The red blood cells get destroyed. So, obviously, there is loss of hemoglobin in your body. So, the iron deficiency will occur. Right? So, the parasites enter the bloodstream and infect the red blood cells. And these parasites keep multiplying inside your red blood cells and then they break open within 48 to 72 hours and infect more red blood cells. That's why there is iron deficiency happens if you have malaria. 19th question. In which week of pregnancy does the human brain begin to grow? First week, second week, third week, or fourth week? Start answering. Please keep yourselves mute throughout the class. I have been repeatedly telling. Okay, let's not disturb everyone. Okay, let's see what is the correct answer to this question. It is third week. In third week of pregnancy, the human brain begins to grow. Okay, here you can see the picture as well. Okay, let's move on to the next. What should we do to help boost the absorption of iron in the body? Consume a vitamin C rich food along with our meals. Sit under the sun soon after eating our meals. Drink water along with the meals. Drink tea or coffee along with the meals. Start answering. Okay, let's see what is the correct answer. It is obviously A. So, if you consume vitamin C rich food along with your meals, it increases the absorption of iron in the body. Okay, here you can see how the vitamin C helps in iron absorption. So the iron is mainly present in two forms in the food, hem iron and non-hem iron, that is inorganic iron. So hem iron, which is present generally in meat, directly gets absorbed with the help of heme transporter protein, whereas the inorganic iron is absorbed in Fe2 plus form. Okay, so the vitamin C acts as a reducing agent to reduce from Fe3 plus ion to Fe2 plus ion. Okay, moving on to the next 21. Addition of which food will increase iron absorption among the following? Carrot, lemon, potatoes, beetroot. Start answering. Okay, let's see what is the correct answer. It is B, lemon. Already we discussed that vitamin C enhances the iron absorption in our body. So lemon is a very rich source of vitamin C, which helps in increasing iron absorption. Moving on to the next, during diarrhea infection, dash milligrams of zinc per day should be given to babies below 6 months. 15, 20, 25, 10. Start answering. We have more three questions to go. Okay, let's see what is the correct answer to this question. It is D. So, if a baby below 6 months has diarrhea, then 10 milligrams of zinc per day is recommended for the diarrhea treatment. Here you can see the table as well. For less than 2 months, tablet is not required. For 2 to 6 months, a half a tablet, that is 10 mg, should be dissolved in 1 teaspoon of breast milk and given for 14 days. If it is 6 months to 5 years, one tablet of 20 mg should be dissolved in either breast milk or ORS or clean drinking water and should be given for a duration of 14 days. Okay, moving on to the next. Poor attachment of the baby's mouth to the breast will result in areola feeding, nipple feeding, breastfeeding, or proper feeding. We are going to discuss a lot about the breastfeeding techniques in the upcoming classes. So, yeah, this is the start. I hope you all are going through the lectures for each particular week and then joining the class, this interactive session. Okay, please keep yourself updated with the lectures of Rupal ma'am. Okay, okay. Let's see what is the correct answer. It is B, nipple feeding. So, if the baby's mouth is not correctly attached to the breast of the mother, it leads to nipple feeding. Nipple feeding means it is only the baby is only sucking the nipple, but it is not getting the proper amount of breast milk as it should, right? Like it is only hanging on the nipple tip, so your baby won't be able to suck properly milk from the breast. Okay, moving on to the next. Essential nutrition actions are a preventive approach to tackle protein deficiency, malnutrition, diabetes, lung infection. Start answering. Okay, let's see what is the correct answer to this question. It is B, malnutrition. Okay, okay, so we had 24 questions today. I hope everyone has answered each of them. Now let's see what is the your score. Okay, let's see what is your score out of 24. Now many people have scored 24 out of 24. That's really great. Even 23 is a very good score. Okay, so whichever mistakes you have done, I hope you have learned through the class what is the correct answer and why you have done that mistake. Please keep that in mind so that you don't repeat the mistake in your exams as well. Okay, if anyone has any doubts, they can say or we can disperse the class. So we have completed week 4. Next week, Tuesday, we will be discussing the questions for week 5. Okay, and please keep submitting your assignments on time and keep seeing the lectures for every week. Okay, yeah, okay. I guess no one has any doubts, so we will disperse and meet again next Tuesday. Thank you, everyone. Okay, ma'am, can you explain question number 17, 18, 19? Okay, let me see which was the question. Already I explained question number 17, that pregnant women can pass black stools after consuming iron tablets. So if you are consuming iron tablets, it is obvious that you will have black color stools. Then 18th question was, if you have malaria, there is a risk of iron deficiency because the malarial parasite destroys the red blood cells, and in the red blood cells there is hemoglobin which has iron in it. So if your red blood cells are destroyed, obviously will have less hemoglobin per se to less iron deficiency. Okay, and what was the question on 19th? In which week of pregnancy does the human brain begin to grow? It is third week. So this is a very direct question. I don't think uh, there is any need for explanation in this. The fetal brain begins to develop during the third week of gestation period. Gestation is the time period from conceiving to giving birth. Neural progenitor cells begin to divide and differentiate into neurons and glia, the two cell types that form the basis of the nervous system. Okay, here you also have kept the picture of in 29 days what is grown, after that 33 days, 52 days, 59 days, 70 days, right? By 3 weeks your brain is almost grown. Brain starts growing. Okay, here you can see the pictures as well. Okay, this is only for brain development, nothing else. Okay, I hope it is clear. Okay, we will disperse and meet again next Tuesday.